Hello and welcome to week 9. Wow, the time is really flying by, and you have been learning so much. And this is all really important. Now, it might not seem to have value at this very minute, but trust me, as you continue on in your education and your career, you will find yourself, like I find myself so often going, wow, I can't believe I remember that. When did I learn that? Oh, wow, a long time ago, but now I need that information. And there it is in my brain. Excellent place to store knowledge. What a great idea. So this week, we're going to talk about public health responsibilities. And you might think that this is only for those who are working in public health, which is an excellent thing. And I think over the last 2 years with COVID, we've all learned how important public health officials and staff members are, but also remember that that leaves a place for you as a medical records, medical coding and billing specialist to find a place to serve your community. So yes, you can work for the hospital, you can work for a doctor's office, a clinic, you can also work for a lawyer's office. You can work for the public health agency in your state. And that's an excellent place to provide and give to your community while they give to you a salary. Okay, see how that works? All right, so one thing I thought it would be important to share is this analysis of health outcomes, because a lot of people misunderstand the origin of an individual's health. So I thought it would be interesting to look at this. Let's look at this. 10 to 20% is medical care. So that is the part for healthcare professionals and what they do to and for the individual to help keep them healthy. That's it. A maximum of like 20%. Then we got 30% genetics. And you probably already know this, that genetics plays a big role in an individual's health, not only with what they may automatically have, but what they might be susceptible to or at higher risk for than someone without that genetic lineage. Okay, thank you, grandma, grandpa, great grandma, great grandpa, you know, all the way back. Okay, 40 to 50% is the individual's behavior. This is lifestyle, social behavior. And you already know, I'm sure, this would include smoking, drinking, recreational drugs. Okay, they all have an impact on you. But in addition, this might be driving too fast, riding a motorcycle without a helmet, things like that. All of those individual lifestyle behaviors contribute to your health. Okay, and then the last 20%, social and physical environment. So you know that certainly, actually just today, I read that Los Angeles is the most polluted out of 2,400 US cities. Los Angeles, California is the most polluted, has the most polluted air. Okay. Now, you know, that's going to affect someone differently than someone, say, living in North Dakota, where the air is fresh and clean. I'm assuming, I've never actually been to North Dakota, but oh my gosh, it's cold up there. And that kind of freezes the pollution. No, I'm kidding. I'm kidding. That's a joke. That's a joke. Don't take that seriously. All right. So social and physical environment. So individual behavior and environment we're looking at 70% of an individual's patient outcomes, health or not so healthy, and that equals non-medical determinants of health. Does that make sense? Okay, so these are outside influences that directly impact an individual's health. So what we now are looking at is an official sector called SDOH, stands for Social Determinants of Health. And these are conditions that individuals experience that are known to directly impact their health. Now, when I say directly impact, I don't mean how this second. It can be something that nurtures. It can be something that slowly deteriorates, okay? And you know this as you see people, and I'm just going to pick on cigarette smoking for a second, just because it's easy, okay? But there are 35-year-olds that die of lung cancer from smoking cigarettes, but there are also 75-year-olds who are smoking cigarettes, who have been for their whole life, who are up walking around, okay? So this essentially plays upon the human body, all of the ingredients that can work toward a high quality of life or not so much. All right. Now, some of these are totally out of our control, but other aspects are within the control of health professionals, health officials, and the government, which contributes money toward research and ultimately the provision of care in some cases, again, as we saw in COVID. Okay, so there are 5 key determinants that are used in social determinants of health. And just so you know, and I may tell you this again later, just because, you know, repetition is a good thing. All right. These are all reportable using Z codes from ICD-10-CM diagnosis coding, okay? So as long as we can get our physicians to ask and have the conversation with the patient and document that in the patient record, now we need you all, the coders, the medical coders, to identify that and report that on the claim form with Z codes. Because once they're reported, then we have the ability to collect the data and identify, something needs to be fixed. Okay, so we look at economic stability, a challenge for everybody, especially nowadays, right? But there are some sectors of the population have greater economic stability challenges than others, okay? And good for you, because you know that education is not only important to healthcare literacy, a person's ability to understand what can help them and make their life better, but also we know that the more education an individual has, the better job, i.e., the better paycheck that individual can obtain, which then feeds into economic stability. You see how it's all intertwined. But the fact is that we have to make sure that our patients have the ability to become educated on their own health. And that's where patient portals come in to be fantastic, as well as the internet. Be careful on the internet. But there are good, credible, trustworthy websites such as medlineplus.gov okay? And even WebMD is trustworthy, okay? So we want to make sure that we help people understand the importance of education in a lot of aspects, okay? Knowledge really is power. All right. Social and community context. And this has to do with the activities as well as the interaction of neighbors and individuals living in a similar area. Health and healthcare. Needless to say, you got to have access to healthcare. Now, this has initially two parts, okay? And number one is physical access to healthcare and the ability to be able to get to and communicate with a healthcare professional. And again, thanks to the pandemic, we have seen a dramatic rise in telehealth and telemedicine. And what that means is even people in rural areas who are maybe 2 hours away from a hospital, or an hour away from a physician's office, don't have to leave their homes and can still get certain levels of healthcare, okay? And last but not least, neighborhood and built environment. And this goes deeper than just what's happening. Are you living in an urban area or a rural area or a suburban area? This has to do also with the qualities of the buildings, okay? In other words, if the buildings and the homes in the area are 100 years old, that can be very exciting with regard to antiques and that flavor of history, and I can see the appeal, okay? However, we also have to remember that new building regulations are there for the protection of those who live and work in those buildings. So we want to make sure there is, for example, no lead paint, no asbestos, which we already have tracked as dangerous to individuals. So when we look at the neighborhood and the built environment, we are talking about construction, destruction, and the materials involved within. Okay, so let's talk about these a little more. When we look at economic stability, and you know, we are living right now in a time of the great, what do they call it? The great resignation. All right. Over the last year, especially, an enormous number of people have quit their jobs. Okay. And now, as the COVID, oh, please, as the pandemic is subsiding, stay away BA2, the next variant. Okay. But as that, people are going back to work. Some people are saying, no, I like working from home. I don't want to leave. Okay. And other people are like, oh, yay. Okay. So the fact of the matter is employment is a foundational aspect of economic stability. So the good news about the great resignation and the time we're living in now is the other side of that coin, which there are a lot of job openings. This may be your great opportunity to get that job that you want. But we also have to look at the employment and the employability of those who live in our community, right? Food insecurity, you may have heard about this. This is kind of a new phrase, but basically what this means is we have people, communities, who cannot consistently get decent quality of food. And this is very, very important. And we're not only talking about fruits and vegetables, but we are talking about everything. And we have seen that, right, during the pandemic. I mean, it's not only a shortage of toilet paper. There's a shortage of simple things like tuna fish. Okay, so we want to find ways to help our communities to make sure that we can help them secure a regular and steady ability access to food, because I mean, you've heard that old saying, you are what you eat, which makes me one big giant cheeseburger. I do love my cheeseburgers. But the point is that we also know that whether or not you like fruits and vegetables, they are a critical part of what the body needs nutritionally. Okay. And for the most part, nutrition best comes from your food. So we have to look out for those in our community who might not be able to access on a regular basis. And that's the insecurity. We're not talking about no food. We're talking about food, no food, food, no food, food, no food. Okay. Housing instability. Again, right now, this is such a perfect time to talk about this. I just saw an article yesterday that was talking about rental properties, and I mean, renting an apartment or renting a house, whatever. But the fact is that due to the situation, the economic situation in many locations in the United States, people are finding that their lease comes up. They don't just renew their lease, they're getting like a 200-300% increase in the rent that they have to pay for the same exact apartment. So maybe they can't afford that. So now all of a sudden they've been living in this apartment for how many years, and now they have to go find somewhere else that fits within their budget. And maybe they still have employment, but maybe their salary has not kept up with a 200-300% increase. Do you see how this can negatively impact an individual's health? And I'm not even talking about the stress. I'm talking about the physical nature and the stress. Oh, the stress. All right. Poverty, of course, has always been a not good thing. No matter how we try, the fact of the matter is that our world, and yes, this is not just the United States, and it's not even just the city that you may live in, it's everywhere. Poverty has long been an issue with which we must deal. And we also know that people who live in poverty have virtually none of the above. And we're only on the first aspect of social determinants of health. It's so incredibly detrimental to the health of a human being, and we must pay attention to it. And think about this. It may seem overwhelming, because at times it really is. But if each one of us does a little bit, a baby step, a baby step, a baby step, a baby step, look how far we can go, right? We got to help each other. This is so important. All right. Now let's look at how you can help. Okay. What can your contribution be? Now, this may be something you can do now, or maybe once you graduate from school, but how can you help the people in your neighborhood? And I'm not talking about getting elected, or we're talking about little things that one individual can do, like offer to speak to a group about healthcare. Maybe it's the Kiwanis Club. Maybe it's a book club that your mom belongs to. Maybe it's your child's elementary school. Okay. There's something that there's something that you can share. And all you have to do is once, just volunteer once. We're not talking about making a profession out of it, just once. And you talk to 10 people, you talk to 20 people, they talk to 10 people, they talk to 20 people, and look how you can share your knowledge, okay? If you are working for a healthcare facility, you can try and propose to your facility to have community outreach teams. Okay. I was teaching on ground with a school, and we connected up with the what was it? The Society for the my brain just went blank, but we connected up with one of the health organizations like the American Cancer Society. Okay. And we booked some space in a senior center and another one in a community center. And we had our students come out, and our medical assisting students and our nursing students, and they did blood pressure checks. They did other little checkups that were just, again, handing out brochures and information about checking for cancer. And people like going out, especially now. They're so happy to get out, mask, no mask, I don't know, whatever. But the fact is that you can do that, okay? You can contact the Lung Association. You can contact Cerebral Palsy. Go out into the community together. Education, a hospital, and an organization. And just for one afternoon, you know, you could educate like 50 people. That's so awesome. You could save a life. Actually, I once got to do that. I was speaking with this woman at one of these events, and she said that because she was gay, she didn't have to get a pap smear. And so I was educating her about the importance of preventive and early detection healthcare. So not long after that, she went to her gynecologist, she got a pap smear, and it turned out she had precancerous cells in her cervix. The doctor did a minor little thing in the office and was able to hedge that bet. This saved this woman's life, because had she never gone for that test, those precancerous cells can become cancerous cells, which can travel. Okay. And the next thing you know, the patient is stage 4. Not good. So you would be amazed at how much one little conversation can have, sharing the knowledge. Okay. Food insecurity. Organize a farmer's market in the hospital parking lot or in the hospital cafeteria, or get a grocery store to donate ugly fruits and vegetables, or those that are left over at the end of the day. You can bring them to community centers in poorer neighborhoods. There were actually organizations that can ship ugly fruit. And there's also a farmers co-op nationwide that works with, you know, because you know what happens to fruits and vegetables, right? If you don't sell them today, tomorrow, or the day after that, it's garbage. It goes in the compost heap, okay? But what if in between it didn't sell today and the compost heap, you can actually give it, donate it to a family that could really use those vitamins and nutrients, okay? I'm not saying give them rotten food. That's not what I said. I said, before it gets rotten, don't let it sit there and get rotten. But this is easy. This is a couple of phone calls, maybe a Saturday afternoon. Talk to your church group. Talk to the people who are in your hospital. You never know. It's amazing what can be accomplished. All right, now let's talk about education. Early childhood education and development is so important. And yes, Sesame Street talks about fruits and vegetables, and that's important. We got to make sure that we are getting to children pre-K. Okay. You know, the largest learning curve in a human being's lifetime is from birth to the age of 5. Did you notice that the age of 5 is when children enter school? So what happens before that? We can't just let Sesame Street do it all, right? We have to help and contribute and make sure, again, you can go and talk to a pre-K group 1 hour out of your day to talk about fruits and vegetables or enrollment in higher education. You did it, right? Why not pass that baton on to others? High school graduation is important, or getting a GED, because the fact of the matter is that it's not only that high school diploma that helps you get a better job. Okay. It's what you learn. And you may not see the benefit to knowing that Abraham Lincoln gave the Gettysburg Address in whatever year that was, because history was not my forte. Okay. But again, you'd be surprised how little bits of information, like something you learned in biology, might contribute to your better understanding how a procedure is done, or the signs and symptoms of a diagnosis. And that can help you more accurately determine the correct code. It's all there. Language and literacy. You know, when we talk about language, so often we focus on those individuals for whom English is a second language. And man, oh man, I got to tell you, I respect every single one of them. If you plop me in the middle of Portugal, I do not know one single word of Portuguese. And I would be so intimidated. And it's so hard to learn a second language, especially as an adult. Okay. But you need that understanding of the language of where you live so you can communicate properly with the doctor or the nurse or the people at the clinic. We also must reach out and find those who speak other languages to interpret for our patients, for our family, okay? And literacy, because without this education, they're not going to understand what you're talking about, no matter what language you're using. We need to take care of each other. Social and community context. So this is the aspect of being a part of your community. There are civic groups, like I said before. You can join a civic group like the Elks or the Shriners, right? Or you can go offer to speak at one of their meetings. Again, one afternoon, do a fundraising flea market with one of their organizations. But we also must remember that we are all put on this earth. We're here, and we got to do this together. We have to work together. We have to fight together. Discrimination is not natural. It makes no sense to judge any other person except on their character, not what you assume is their character based on their age or based on their heritage or based on the way they dress. And everybody does that, don't they? We have to work against that. Incarceration, being in jail or prison, does put a damper on one's ability to stay healthy. It is not a healthy environment. I don't know personally, but the fact of the matter is that these people come out of jail, out of prison, into our community. It is to our benefit to help them get back on the road to success. And social cohesion, which basically talks about the community working together. Why not? If you need a help, you need a boost, okay? Are you really going to say, no, I need to get over this wall, but I don't want you touching my shoes? That's ridiculous, okay? We need to work together. We are all human beings. All right. Care about one. I'm not telling you to go to somebody's house and cook them dinner, although that would be nice. Although they may object to you breaking into their house to cook them dinner. They might, no, you know what I'm saying. I was trying to be funny. It didn't work. I'll just keep going. How's that, huh? All right. You know my jokes. Sometimes they're star sapphires and sometimes cubic zirconia. All right. So what can you suggest? All right. Every healthcare facility serves a neighborhood, whether it's a hospital, a clinic, or a doctor's office. What can you propose to help integrate your organization with your community? And again, I said propose. I didn't tell you to take on a whole new everything by yourself. What I'm saying is you think of an idea, like starting a newsletter that can be distributed in the community. And, you know, in the olden days, that meant money for printing and postage. Now, all you have to do is post it on Nextdoor, right? Or on Facebook, create a Facebook community and share with the people who live in your area. I mentioned this before, visit a pre-K or a kindergarten class, talk about fruits and vegetables. Or maybe you go to the farmer's market and find somebody and bring them to the kindergarten to talk about fruits and vegetables. We're talking about half an hour, okay? Phone local community leaders, your priest, your rabbi, your imam, an assembly person. You know, politicians, we're coming up to an election year. Politicians are going to be very eager to be seen and get involved in community events. Okay. Look at your local leaders. See if you can't get a community garden going. Contact the YMCA. YMCA. Okay, sorry. I'll just keep going. Health and healthcare. Well, you know, remember before when I mentioned this and I said there were two parts to this. And of course, the first part is physical locality. We are talking about geographic access to healthcare. And telehealth has extraordinarily expanded that, not for everything, right? But when we add in telehealth and M-health, which is mobile health, which has to do with devices like a home glucose monitor or a smartwatch that can either register your blood pressure or your heart rate, and then you can tell your doctor what it is while you're on the telehealth video conference. Or there are devices that will transmit information. Did you see they now have an EKG device that works with your iPhone and this little tiny pad? It's amazing, right? Okay, we also want to talk about access to health insurance because, as we all know, healthcare costs a lot of money. Now, why does it cost a lot of money? It costs a lot of money because everything costs a lot of money. Don't be silly. You know, look at the cost of a quart of milk and compare that to 10 years ago. So my point is, and I'm not even going to mention gas, as in gasoline that goes in your car right now. Forget about that. My point is that healthcare, especially in the United States, is fueled by innovation and technology, and all of that costs a lot of money. It just is. So we have to help our community understand health insurance as well as healthcare. Not only health literacy, but health Okay. Sorry about that. Not only health literacy and understanding what it means to have hypertension or high cholesterol, but health insurance literacy, understanding what a deductible is, what a premium is, copay, co-insurance. That's something else you can do for your community. You learning that in school, right? It's part of your education here. Well, go share that. Go share that with a high school class or your senior center or your church group or your shul or your mosque, whatever. All of those people, they have no idea. They just don't know. But you know, because you're learning it. Share the knowledge. All right. And as we talked about before, the neighborhood and built environment, and this, as I talked about, the environmental conditions of your area, as well as the quality of housing, but also look at access to food that support healthy eating patterns. And do you see how this has now come full circle? Also, crime and violence. I was talking to a friend of mine just yesterday who lives in New York City, and she was telling me that people go around and just like push people down the subway steps, not to rob them, just to do it. They hit people in the face for no reason other than to just do it, not to rob them. It is beyond my comprehension how people can do that to each other. But then we have community watch programs. Okay. We can work with the police departments and do non-police patrols, or there are lots of different things that you can do, you can participate in. And again, sometimes it's sending out emails, sometimes it's making phone calls. Oh, who answers the phone anymore? But the point is that I know you feel overwhelmed because life is overwhelming, especially now. But you know what? Everybody else in all those houses and all those apartment buildings, everybody is feeling overwhelmed. So you know what happens when we get together? Even a little bit, we get together and we go, I'm overwhelmed. You're overwhelmed too? Wow. Oh, that kind of makes me feel better. And then we can look at ways to help each other. Just chip away. Chip away. You can do this. And I'm going to tell you something else. Sometimes when you do something for someone else, just out of kindness, it makes you feel better. Isn't that amazing? It's true. Absolutely. All right. So healthcare professionals also should do what's called a health impact assessment of their community. It's a decision support tool that is produced by the CDC and the Department of Health and Human Services. And the goal is to identify and help the community balance out environmental issues, social issues, economic factors, that just to tweak things to start promoting health and well-being of its members. We are not talking about turning an entire community into vegans, okay? But if you can get one person to eat 2 more vegetables a day, you just really made a positive impact on somebody. And if all that is contacting somebody with a farmer's market or the farmers in your area and the outlying areas of your town and getting them together for a few hours on a Saturday and do a farmer's market. You know, the hospital where I used to work used to have the farmers come in, a farmer's market come into the hospital cafeteria once a week for a couple of hours, and staff members could come and buy these fruits and vegetables at a discount. It was great. And you know what? It was great for the farmers too. Yes, because that's how they make their living. Growing, selling. buying, eating healthier. Community health is in everything. You want to look at not only social policies, but what is going on in your community. For example, if you might be interested in architecture or you might be interested in construction, okay? I was reading this study about the area where they were redoing the interstate as it came through this particular town, and it was great. Okay, ultimately great for economics, and of course everybody going to and from work, you know, so important. But you know what they didn't really think about is when they were rebuilding the structure of the interstate and the exit ramp and the on ramp, that as they were breaking up cement and filling cement, they were putting dust in the air, and these particles were falling on the homes of the residential area that was right there along that street. And you know what? Some of the people along that in that little neighborhood started having respiratory problems, and they didn't even know why, because it was really hard to put two and two together. So if this is something that interests you, you can volunteer to be on a community planning committee. Not because you know anything about engineering or traffic flows or traffic lights or anything like that, but because you can say, you know what, we have to look at the fallout during construction of the neighborhoods. We have to find a way to help these people. You can give them the masks that we maybe please don't need anymore because COVID is almost over. Stay away, BA2. Okay, but you know what I'm saying, right? All right. Also, in your reading this week is information about state mandatory reporting. Now, there's a lot that is common with all 50 states with regard to what a healthcare provider is required to report to the state. And infectious disease diagnoses like COVID-19 is required to be reported to the state health department. Also, abuse and neglect of another human being. Now, we're all pretty familiar with child abuse and neglect and reporting. I want you to remember adult abuse or neglect. You know, this is really important if you're working in a doctor's office or a clinic that sees seniors, and I mean like people in their 80s and 90s, because there are some of these individuals that the only time they're out of their house is to go to the doctor. And they may be being abused by their daughter or their daughter-in-law or their son or their son-in-law or their nephew or whoever might be their quote unquote caretaker. So it's very important for you to keep an eye out and keep private communications with the patient to make sure. Do not do that with the son or the daughter in the exam room, because the patient will be too afraid to tell you, just like a child, just like a battered woman. Okay. We also are required in hospitals. If you're working in a hospital, we're required to report hospital discharges from the hospital, an acute facility, to a nursing facility, or back out to the community, which usually means to home. It might mean to a group home. We're not just putting them in the town square. Okay, they got to go somewhere, but we have to report that to the state, as well as hospital admissions and where this individual came from. Were they admitted from a nursing facility or directly from the community? Okay, you don't have to worry too much about this. I'm just trying to provide you with foundational knowledge and understanding. Okay, all right. For those of you in HIM115, you got to read chapter 9. And again, I want you to think about everything that you learned today about social determinants of health, in addition to what is shown in the chapter. Okay. And then, of course, you got to do the homework. It's just required. Okay. Got to reinforce that knowledge. And do you have questions? Are you not sure what to ask? Or maybe you want clarification. You think you understand, but you're not sure you understand. Email me. How easy. You could email me 24 hours a day. I will respond to you within 24 hours, and I can answer you via email. We can set up an appointment to speak on the phone. We can do one-on-one Zoom. We can FaceTime. We can Skype. Whatever you need, I'm here for you. You know that. Okay. Have a wonderful day and share the knowledge, because that's so important.